So, hello and welcome to the Orrville Area Safety Council meeting for December. We're very happy to have you with us today, and our topic will be addiction disease in the workplace. We'll be getting to that in just a couple minutes. We'll make a couple announcements as we're waiting for some additional folks to join us. So as a reminder, if you are holding a safety watch party today, that means that you are viewing this webinar with more than one person at your facility. You have an opportunity to be entered into a drawing for a $100 gift card. All you have to do is to take a picture of your group excuse me, your group at your facility, write the names of those people down, send that an email to safety@orrvillechamber.com, and you'll be entered into a drawing. And this month, the $100 gift card is to Michael's Bakery. So that is a great seasonal gift that you could have a tray of cookies or treats for your holiday party. So if you have an opportunity to grab somebody and pull them into the webinar, we'd be happy to have as many people join us today as are able. So our November watch party winner was Orrville, and they received a $100 gift card to the Dutch Kitchen. So I wanted to announce that the Growing Healthy Habits Lose a Ton, Win a Ton competition is open, and a registration for that is open. So if you have a team of coworkers that are interested in losing some weight in the new year, I encourage you to sign up for that and participate in that competition. I will post a link to the registration information for Lose a Ton, Win a Ton in the chat box that you can check out throughout the program today. Our January 12th webinar will be on the topic of active shooters in the workplace, and that'll be presented by a representative from the Wayne County Sheriff's Office. I think that becomes a timely issue, looking at the unfortunate circumstances that happened in Michigan last week. So it's a good reminder for us to review all of our protocols for active shooting and make sure that we are keeping our workplaces safe. Registration for that webinar is not currently open yet. I'm still waiting on a couple details to get that all put together, but that will be posted at orrvillesafety.com before the holiday. At this time, I'd like to turn things over to Kelly Ott, who is our Ohio BWC representative today. She is filling in for Eric White, and we're glad to have Kelly with us.
All right, thank you. Yeah, big shoes to fill. All right, I'm going to try and share my screen, and hopefully I will find the right PowerPoint to share. There we go. All right, can everybody see my screen now? Excellent. All right, so just some things to keep in mind that for the next fiscal year, when we start, at least until June, we're still going to be virtual. The rebate program is still suspended. We don't have a CEO requirement, and you do not have to fill out a semi-annual report. So that's just a little reminder. I want to remind, if you are a public employer, so if you are a city, township, village, oops, okay, here we go. This is where my slides start to go, and I'm not. All right, let's go back. That you do need to complete ISSP requirements, and you can do that by attending one of our webinars or our virtual classes. They do have to be 3 hours in length. Your ISSP credits for publics are due by December 31st. So here are some opportunities for you. We have PERP record keeping. If, again, you need to understand how to do your records for safety incidents. Special investigations on December 14th. Electrical hazards, recognition, and abatement. Maybe you have a lot of lights out there, or you've got electrical things going on. It's really important that you understand, or maybe the electric heaters, they need to be plugged directly into the wall, not into a strip outlet. HAZCOM, hazard communication, and bloodborne pathogens. All right. And where can you find these? You go to www.bdclearningcenter.com. You sign in, and this also gives you the times of when these are being offered. Top 10 OSHA, just to remind everybody, falls, especially this time of year, if you're on ladders, if you're hanging lights, respiratory protection, especially with COVID, really important. If you are using N95 respirators, they may fall under that standard. And so you need to be making sure you're following all the proper requirements and that you have a respiratory written program in place. Scaffolding has if you need help with any of these, again, you can reach out to us virtually at the BWC Safety Consulting, and we can help you with written programs, with reviewing it, what you need. We do have some little micro videos, which I think are pretty interesting. They're 4, 5 minutes, 3 minutes in length. So again, if you need here, if you need like a real quick little reminder to your people, they're available on YouTube. We've created them for you. So you can just say, hey, remember when you pour that, I used to have people who did ink thinners and they would take them from a large container to a small. You have to put labeling on it. So if you want to remind them, there's a little 4-minute micro training. Also captures your training for those OSHA requirements. That's pretty much it that I have. But again, Publix, make sure you get your requirements in. If you are looking for your ISSP credits, stay safe in the slippery falls. Stay safe with the snow and ice. Make sure you have a program in place to keep your employees safe. All right, that's what I have, Lori, and I'll stop sharing and we can go back to the main program.
Okay, thank you very much, Kelly. We appreciate those updates. And as always, the Bureau has a wonderful website with lots of information and connections for you. Or if you need help navigating that, you can always reach out to me and I can connect you with a BWC representative to assist you. So at this time, I'm going to turn things over to Ryan Matthews, who is on our Safety Council Steering Committee, and he will be introducing our speaker for today.
Thanks, Lori. It's my pleasure this morning to introduce our speaker, Rhiannon Whalen-Harris. Rhiannon works as a Director of Community Relations and Prevention with 180. Rhiannon supervises a department with 11 individuals who work to provide community outreach regarding the services of 180, as well as education to prevent substance abuse disorder, violence, and other behavioral health issues. She is certified in youth and adult mental health first aid, as well as sexual assault advocacy, and she's a member of several state and local coalitions, including the Partnership for a Drug-Free Wayne County, the Ohio Men's Action Network, and the Suicide Prevention Coalition of Wayne and Holmes County. Rhiannon holds a Master's of Education in Educational Psychology from Kent State University and a Bachelor of Science in Education, as well as a Bachelor of Art in Psychology from Cleveland State University. She has been with 180 since March of 2012. Please welcome Rhiannon Whalen-Harris.
Thank you so much, Ryan. And can you see my screen with the PowerPoint, Ryan? Is that coming up?
I can see it. Looks good.
Okay, very good. Thank you so much. So I appreciate that, and I appreciate the opportunity to be able to present to you all today. Again, I'm going to be talking about addiction, disease, and the workplace. We have 180 has a what we call drug-free workplace program, and it was built off of the standards that are created by the Bureau. So, there is programming that is in place to be able to help really set the standards for businesses. And so our program being one of the agencies that meets the criteria of having knowledge of substance use disorder, then can present this information to be able to help meet the standards. So feel free as I'm moving through to post any questions that you have. Certainly I want to try to address questions either as they come up or we'll try to address them at the end, kind of depending on how the flow goes. And then, of course, you can see my contact information right here, which I will post again at the end in case anybody has any follow-up questions that they'd like to get in contact with me directly. Oops. All right. So what I intend to cover today, I think it's important that I give you at least a really brief overview of who 180 is, at least in the context of the substance use disorder treatment or services that we provide, especially because one of the things that I'm going to emphasize is that when we do our drug-free workplace programming, we're really encouraging the businesses to be able to understand what providers are available so that they can link employees to the access of that sort of service. So being one of the providers of substance use disorder treatment, I want to give you at least that brief overview of who 180 is. And then I'm sure that you saw within the invitation for this presentation, I intend to cover briefly what addiction disease is, how it impacts businesses, what should be in place in order to protect the workplace, and then how the workplace can also be supportive. Again, this is sort of an overview of the actual programming that we have available. So know that I'm going to really fly through a few of the screens just because what I'm doing is giving you brief examples of the information that we would cover within the actual program. So in terms of who we are as an agency, we have multiple primary service areas. Many people know that we rebranded back in 2016. We were previously known as Every Woman's House or Steps at Liberty Center. And that's because of our two core programs, the Every Woman's House being the Domestic Violence and Rape Crisis Center services, and then Steps at Liberty Center, which was housing our substance abuse and addiction services. Those programs were expanding, and then at the same time, we had expanded to become a more general mental health service organization, as well as providing the housing and supportive services and community relations and prevention, which is the programming that I supervise. I'm going to talk a little bit about the continuum of care that we provide just in relation to substance use disorder. The prevention is a very big piece that we're dedicated to. Our mission is helping people change direction. So with these substance abuse and addiction services, we started back in 1974. I'm not going to belabor a lot of these details, but it's of course important to recognize that we have been in the community for a very long time. We have comprehensive care in relation to substance use disorder treatment. So we do everything from the assessment and really finding out what is happening within that person's situation to being able to provide the counseling and other sort of treatment services. We just recently started our partial hospitalization, so there is some in between in terms of whether a person is going through outpatient treatment, intensive outpatient treatment, or residential treatment where they're actually with us. In addition, we have medication-assisted treatment running through an actual medical department with us, and then a variety of other support systems that really help us to get people into treatment as quickly as possible. We utilize evidence-based practices. Certainly, I'm not going to run through this, but just kind of a recognition that we rely on many different types of treatment so that we can really meet people where they are. On this previous slide, there was the slide or the picture of the Noble House for Men, which is our residential treatment. And then on this slide, we have our newest facility, which is the Women's Residential Treatment Facility. I mentioned that we have a medical department. This is our medical director, Dr. Nicole Lieber, who is a specialist in terms of addiction medicine. And then she also is very open about the fact that she is in recovery herself. And so she has a pretty unique perspective to be able to link individuals to appropriate treatment for substance use disorder. She's very well known throughout the state as well as throughout the nation because of some of the assistance that she has given in terms of writing treatment plans for addiction. And then I already mentioned the programming that I supervise is the community relations and prevention. So this gives you a little bit more of an idea of some of the programs that we're doing out in the community in working directly with youth, working directly with the schools. We do a lot of focus on what's called environmental prevention. So really looking at how the environments can unfortunately support youth use of substances, and how we can better teach adults and the general population to be able to prevent those issues from happening. So again, I want to speak briefly about what addiction disease is, and this is really going to be the most brief sort of introduction. We do full 2-hour programs. Dr. Labor actually does a 2-hour presentation on the neurobiology of addiction. It really helps to break it down much more thoroughly in terms of what's happening within the brain when a person becomes addicted to substances, and why it is that we refer to addiction as a disease. So please know that I'm going to do an overview, but it's very, very little information in comparison to what really goes into understanding addiction disease. I want to start at a place of recognizing that, there's multiple different things that we can take into context first when it comes to the use of substances. So there are individuals who use substances and it's not considered to have, negative consequences for them. There are individuals that are using substances because it's only beneficial to them. Individuals that are using a prescribed medication the way that it has been intended for them to use, that, would be one example of that. Or individuals who are using a legal substance like alcohol and it's not causing the negative consequences, that would just be considered use. Versus what we refer to as substance abuse, which is where individuals are using mood altering substances and it's causing harmful consequences. However, this individual can quit or change their use. So again, this is the definition of substance abuse. And then we have addiction that, is an unhealthy continued involvement with the drug despite the harmful consequences. And I'm going to go a little bit further into defining addiction that helps us to really look at what that difference between substance abuse and addiction is. I'll point out, as it says on the bottom here, that 30% of the American population are considered non-users of any sort of substances. What we tend to see is that a lot of people have a misconception about addiction because addiction was really misunderstood for a very long time until our medical field got to a point where we were able to start to look at the brain, to really do neuroimaging on the brain. We didn't truly understand what was happening in terms of addiction. And so oftentimes, actually, I'll go back for just a second so that I can make the point that, again, oftentimes what people think addiction is a definition of what substance abuse is. And so these individuals are thinking that a person that has addiction disease is able to quit. They're just making the choice not to. I want to point out that I use the term substance use disorder much more than referring to substance abuse or addiction. Both of those things fall into what is categorized as substance use disorder in the DSM-5. So more from that psychological treatment perspective, it's referred to as substance use disorder. And again, you've got multiple different things that categorize it as such. which is an overlap of some of the definitions that I already pointed out, being unable to control the use of substance, failing to meet obligations at work, home, or school, having poor health, spending an increased amount of time getting, using, or recovering from the effects of using the substance. So in terms of addiction, this is really the definition that we look at. That drug addiction is a recurring chronic disease that can be treated effectively, similar to other chronic diseases. I want to point out, as I kind of already alluded to, that addiction is not a self-inflicted moral issue that people can just power through. And because of that confusion with substance abuse, oftentimes people really don't understand this. They really think that, you know, if someone has addiction disease, they just need to have more self-control. They just need to, you know, as it says, power their way through it and they'll be fine. But what we know is that there are actual changes that are happening within the brain that make it really likely impossible for that person to just will themselves, you know, into recovery, the same way that a person wouldn't be able to will themselves into recovery from any other disease that they have. So we know, you know, based on the neuroimaging, that we have these compulsive behaviors. And of course, you know, there's the behavior of the continued abuse of the drug despite the negative consequences, in that there's these persistent changes within the brain structure and function that again make it really nearly impossible for most people to just be able to recover on their own without actual treatment. It's important also to point out that a disease is defined by the different criteria that you're seeing on the screen here. So this is, you know, relating to any disease. So, you know, a disease of diabetes, for example, or, you know, anything else really that you can think of that is actually categorized as a disease, it has to fit all of this criteria, that it's chronic, it's progressive, it affects multiple organs, it's prone to relapse, it may cause death, but it's also a treatable disease. And this is the reason, again, why addiction disease is categorized as such, because it meets all of this criteria. And as I mentioned, you know, one of the major shifts is that neuroimaging has happened with the brain that has really allowed us to better understand how that particular organ is affected. So moving from there, I just want to point out that we, of course, have some commonly abused drugs. Alcohol, tobacco, prescription drugs, and marijuana are the most prevalent. And then we have some other relatively high frequency in terms of use. That's benzodiazepines. Those are your prescription medications that are generally used for things like anxiety. So Xanax, things of that nature. Cocaine, various opiates, and methamphetamines are also things that we see commonly. I'm going to come back to just a couple of these as I point out some of the examples of the programming that we actually move through when we're doing our drug-free workplace program. But I want to talk first about the impacts on businesses. There's a lot of data in here. So again, I'm not going to move through every single piece of this because I think it'd be a bit of an overload, but we can talk about at least a couple of these points, and I'll move through kind of quickly. We know that about 10% of US workers abuse drugs or alcohol or both, that most substance abusers are employed, and that about 60% of workers know someone who has reported for work while under the influence. We know that anyone can be a substance abuser, and that's one of the major things that we focus on, helping people to understand when we're doing the programming, so that you know, everybody kind of becomes that advocate for being able to be aware of these issues, recognize them, to understand from multiple perspectives, like to understand that as an employee, it's a safer environment for you if you report concerns. that it affects, long-term in terms of your pay, that it also can be safer for that individual person who may be reporting under the influence, because the sooner that can really be recognized and the person can potentially get help, then, the better off that they tend to be in the long run. We know that the costs are certainly incredibly high to businesses. So about $181 billion annually is spent on substance abuse in a more general perspective. Abusers are, of course, less productive. They tend to make more mistakes. They tend to lose more time from work, and of course have higher levels of accidents. And so, this would be a reason why implementing a drug-free workplace policy would be really important, to be able to try to counteract some of these issues that can come up. Just a couple more statistics in relation to that. Substance abuse leads to theft and crime within the workplace, high level of fatalities, occupational accidents, etc. In terms of full-time employment, we can look a little bit more specifically at current illicit drug users having about 3+ years of past work experience. The increase of the unexcused absences, which is just a little bit of comparison of individuals that are illicit drug users versus the more general population. Lots of more specifics here in terms of looking really at the research of, what do we know about, the absences and such with individuals who are abusing substances or have the substance use disorder, such as addiction. And then in terms of supervision or being a leader or a business owner, we know that there's a lot of other things to think about. Like, it's not just the individual employee, but it's also taking away from those leaders in terms of diverting their time. It creates friction among the workers, creates poor morale, a lot of waste because of poor judgment decisions, and of course, damaging the public image as well. So what should be within the workplace in terms of protecting businesses? The recommendation, of course, is, a drug-free workplace programming that is really outlining that drugs and alcohol are prohibited, encouraging voluntary help for individuals who have substance use disorder, creating a health and safety plan around substance use disorder specifically, putting and safeguarding the assets and the trade secrets and the company integrity, and really looking at what the laws are. We, of course, know, and I'm sure that you all are much more familiar with this than I am, the OSHA requirements in terms of protecting against recognized hazards, and substance abuse, of course, being one of those hazards. Sometimes what we're seeing is that businesses are kind of stopping there. They put these recognized hazards in place, or these policies in place, but there aren't the further steps in terms of really educating or putting a true drug-free workplace programming into place. With the policy, of course, we want to see a written policy, and I think that most businesses have that because of the OSHA standards, but it's also about creating an awareness program. It's about taking it the step further to have the reporting requirements and reviewing those, and really giving the time to be able to walk through what that process looks like, especially with the supervisors, so that they have a full understanding, walking through the disciplinary actions, and then also what sort of rehabilitation can be supported. And it's not uncommon for us as a treatment facility to have businesses that are calling us in kind of the aftermath or in the process of, something very serious has happened. And now we need to look at what do we do with, all these different processes. So this is, of course, one of the aspects of really getting ahead of things before it becomes an issue. So the recommendation through drug-free workplace programming is that you're doing education sessions on a yearly basis that include all employees, and then also a separate section that is just for the supervisors. So the supervisors or leaders are going through 2 different sessions in that minimum yearly time frame, and the employees go through the 1 section. So you're reviewing with the employees the drug-free workplace policies. I've already talked a little bit about that. You're reviewing with the employees how this really affects them in terms of things like workers' comp, that individuals are likely not eligible for workers' comp if they have an accident because they're under the influence of a substance, how this ultimately affects their pay in different ways. You want to, have these education sessions to help people to better understand some of what I just went through in terms of the difference between use, abuse, and addiction, because that is so misunderstood within our society. We see individuals who, are suffering from this particular disease who just don't have the access to the education and therefore aren't going to seek treatment. And as an employer, if you're able to provide that education that could get somebody into a support or treatment kind of direction, then that's very likely that you are going to have more productive employees within your environment. So we also want to look a little bit at commonly abused drugs and talk a little bit about like things such as low risk use versus abuse. Illicit drugs would fall into abuse because there are potential negative consequences, but something like alcohol is oftentimes looked at as a substance that isn't dangerous because it's socially acceptable. It's a legal substance. So what we're really doing is helping people to understand that alcohol, it's listed here as being, no safer than other drugs. Alcohol is actually one of the most dangerous substances. Excuse me. In fact, what a lot of people don't understand is that there's only a couple of substances in which a person can actually die from the detox process of. That is alcohol and the benzodiazepines that I mentioned before. In fact, our doctor tends to refer as benzodiazepines as a pill form of alcohol. So these are remember I said, these are the commonly prescribed medications such as Xanax that are used for anxiety, Valium, things of that nature. So oftentimes people think because it's a prescribed medication or it's a legal substance that it's not dangerous, but it's incredibly dangerous. They think that something like heroin or opiates in general is more dangerous. Definitely, there are dangers from a substance like that, but people don't die from the detox process of an opiate. They can definitely have other physical consequences of going through that detox process, but just the withdrawal of that substance alone is not physically dangerous the way that alcohol or the benzodiazepines are. So really helping people to understand that, alcohol, of course, is an incredibly addictive substance and is something that, needs to be considered in terms of truly understanding what use of the substance can do to an individual. So the other things that we go through is helping people to better understand what's considered to be a standard size of a drink, because this is another piece that is very misunderstood within our society. When beer is regulated as a standard size of a drink, it's looking at 5% alcohol within the actual substance. And what we're seeing with a lot of beers, especially because of the microbreweries and such, which have become so popular, is that a lot of beer is much, much higher in the percentage of alcohol, sometimes even within the high teens. And so when someone is having one drink, or what they call one drink, what they're actually potentially having is, 3 or more times of what's actually considered to be one drink when it comes to beer. And even like the glass right next to the beer can gives us a good indication of, what that standard drink looks like, because like think about, the average person that goes to a restaurant or to a bar, they're not going to be very happy if they get a beer that is filled up like that. They want a beer that's filled up to the top because that's what they're paying for. And again, now we're looking at, a larger quantity of the actual alcohol that's being consumed, plus the potential higher percentage of alcohol or the intoxicating substance within that consumption. So then we're talking a little bit more about, what's considered to be low risk drinking, helping people to understand that there is no low risk anything for people who have developed addiction disease. Once a person has addiction disease, they always have addiction disease, and it is to every substance. There is no specific addiction to one substance. Because somebody becomes addicted to heroin, they are now also, addicted if they're drinking alcohol. So, again, there's no low risk use when it comes to an individual who has addiction disease. That's where you also, we won't spend a lot of time here, but learning more about like harm reduction becomes important, because you can think about something like, if somebody has addiction disease, what happens when they go to the doctor and are prescribed an addictive substance? That's where harm reduction is really important, because we need to look at, what's kind of the safer choice within that situation. Is it safer for them to use the addictive substance under some sort of regulation, or is it safer for them to avoid the addictive substance? So we talk, of course, about marijuana as well, pointing out things like that marijuana used to only be recognized as a depressant, and now it is actually recognized as a hallucinogen more often than a depressant, because the level of THC that is available in marijuana is so much higher than it was 20 or 30 years ago. And there are cases of products that have 99% more THC than marijuana did 30 years ago. So the effect that a person is experiencing is really different than that depressive effect. We want to teach people that, marijuana is fat soluble, which means that it stays in the body much, much longer. And so where, other substances somebody can use and within a shorter time frame test negative, someone can use marijuana and for 2 weeks or more still test positive for the THC, because it's absorbed into the fat of the body. Marijuana is an addictive substance. That's another big myth within our society, where people believe that it is not addictive. It is one of the lower addictive substances. So people aren't as likely to become addicted to marijuana as quickly as they are with other substances, such as an opiate or something like methamphetamine sort of stimulant. Marijuana is also something that people can overdose on. The difference with marijuana is that people don't die from the overdose. So there's a difference just within that. in terms of understanding that overdose does not automatically mean that there is death, but people can overdose in terms of the physical effects that it has on the body. And when you add that with hallucination, there's some other dangerous, consequences that can come into play. I'd like to point out, of course, that, marijuana right now, many people, of course, are very familiar with the fact that it is legalized under what's recognized as medical terms in Ohio. And then in other states, we're seeing it legalized also recreationally. And it's really interesting that even under medical legalization, we're seeing these products that certainly don't look like anything medical from my perspective. They're actually very much targeted toward youth in terms of, being very youth friendly with the candies and things of that nature. So that's its own concern. And then these are a lot of the products where we see these incredibly high levels of THC. The picture on the top right-hand side is actually showing a whole cookbook that is just about how you make these concentrated different treats in terms of using a tincture, which is a very, very concentrated form of THC. So within medical marijuana in Ohio, the law does not prohibit an employer from refusing to hire, discharging, or taking an adverse employment action because of a person's use of medical marijuana. So, just because a person has that recommendation card, if an employer is still, making that decision that they are not okay with an individual testing positive for THC, then, they're allowed to do that. And the recommendation card doesn't really matter at that point. There's some other points in terms of medical marijuana, and we tend to use quotes. Certainly we understand that this is running through our medical system, but one of the major things to point out is that marijuana is not a prescription, it is a recommendation. And that's very much confused. It has not gone through our FDA process to be defined as a medication. Therefore, we do not have anything in place to say, like with a regular prescription, we can say based on a person's height, body weight, etc., they should take this amount on this, regular basis. That's not the case with medical marijuana. So we still have a self-medication component that comes into the use based on these recommendations. Okay. So, coming back to this list of the things that we're trying to emphasize in terms of what can be taught to employees, it's also about how they can recognize a problem, how they can get help, what happens if they report at work, and then what sort of help is available. Then we do, as I mentioned, that additional programming that is about teaching supervisors what the scope of the issue is. So, the statistics and things, we get deeper into talking about that. Really looking more into what the effects of the substances are in terms of immediate and long term. So there's a couple of other things that I pointed out. Amphetamines are continuing to be on the rise within our society. So these are just some of the immediate effects that a supervisor or another employee may see from an individual who comes to work intoxicated under methamphetamine or a prescription amphetamine. The more long-term kind of chronic effects that don't necessarily mean that you would automatically accuse somebody or even necessarily move through any sort of procedures, but definitely it can help you to be a little bit more alert. It could be more of those red flags that if these are matched with other things, the short-term immediate kind of effects that certainly you'd want to be more concerned about an individual. Again, heroin, I won't go through all of this, but some of the immediate effects. And then we go through some of the more long-term kind of effects that you may see. This is just, a little bit of information to show, like the picture on the top is identifying the average amount of those substances that are generally an overdose amount. And so it's a pretty major difference, obviously, as you can see, between heroin, fentanyl, which is a prescription painkiller, very high level painkiller, and then carfentanil, which is very high level prescription painkiller that's mainly used for very large animals. And the reason that I point this out is that we're seeing a continued increase of fentanyl being cut into multiple street substances. And so even things like marijuana, where people would not intend to have that sedative kind of effect, they have fentanyl that's being without their knowledge, it's actually within that substance that they're using. And that's why we continue to really promote the Narcan, because, we continue to see a rise of overdoses. So overall, what we're teaching the supervisors or the leaders is how they can look for the abnormal behaviors, what those behaviors might look like. And then we continue to teach the supervisors things like, are you aware of what paraphernalia is, the different tools that a person would use for then somehow consuming or using the substance. And that can be a long conversation in and of itself, because we have some of the things like you see in the pictures here that are more straightforward, that even if a person doesn't really understand substances, they probably would see these things and be, suspicious of some of them or concerned with some of what they're seeing. But then, also knowing that there's various ways that people make things like pipes, so that they can, consume or use without it being suspected. This is showing the fabric softener wrap that is used so that people can exhale smoke, and then it's less likely to be detected because it kind of gets absorbed within the fabric sheet, and then the scent from that fabric sheet is more likely to come out. We see how some of, pipes can be really disguised as other things. So this is another thing that's really common for us to say, or for us to hear, businesses or leaders say to us, like, well, I don't think that they've ever, used anything while there. Like, I've never seen any sort of like pipe or something, and I'm around them all the time. Well, somebody could be using THC within a vape. And so, they're going to, smoke their vape or to, hit the vape, and someone thinks that they're just using it for tobacco, or oftentimes it's described as they're just using it for the flavor of it, when in reality, they could potentially have THC in there. This is just another, this is a hoodie. We actually have some of these here that we use for our presentations, where a person, like, these hoodies are made for vaping, and so you can have a vape in one side and you actually exhale into the other side. And this one is conveniently made so that you can also store additional things right in the pocket. And thinking as well about, what are people wearing in terms of if they have logos on, because sometimes those are things that are actually promoting substance use. And again, wouldn't be appropriate reason to automatically accuse somebody, but would be some of those red flags that we want to be aware of. And then we go on to talk with the supervisors or leaders about how to confront suspected abuse and how to be helpful or supportive. So we actually run through some of these interventions. We do some role playing so that there's some comfort behind doing some of the confrontation that needs to take place, and helping people to find their own place. Like, oftentimes, we've had a lot of experiences where people say, well, I used to work alongside these individuals. They were peers of mine, and we used to go out drinking, and I just don't feel comfortable with, confronting them when, we kind of used to party together or something like that. Like, you have to help your leaders to be able to get past some of those internal biases that they have. And then, of course, how to help is the same thing that I intended to wrap up with today. So I'm going to wrap up the presentation in just a moment. But overall, to be able to help somebody is to be able to help them recognize that there is an issue as early as possible, to be able to link them, to professionals within the field and different resources. And, you know, just the process of getting someone started can be really challenging. So as supportive as others can be within those beginning stages, then the more likely that successful recovery can be in place. And so, you know, just understanding that a person isn't likely to be successful without some sort of support, without professionals in the treatment field. And then, of course, being able to, you know, understand confidentiality, what that means within your own business, and support that appropriately. And this is just some of the examples of some of the local help, as well as some of the national help that we would spend more time on within the actual presentation. Any questions for me?
So you can post a question in the chat box. You'll see a little chat icon at the bottom of your screen if you have something that you would like to ask. So we'll keep an eye on that in case someone is typing something in. But I want to thank Rhiannon for spending time with us today and sharing this information with us. Very important to pay attention to for the health and safety of our employees. I did post in the chat box a link to the Ohio BWC's DrugFree program. If you're not currently enrolled as a drug-free workplace, I encourage you to take a look at that information. If you are looking to start a drug-free program, implementing some of the things that were discussed today, the Ohio Bureau of Workers' Compensation does have drug-free grants available that you can apply for to assist with some of the expenses involved with getting a program started. So we also will share the recording of today's program on orrvillesafety.com. So it'll be available in the archives if you would like to share the information with others in your organization or go back to look at any of the slides, you'd have that available to you. So I see no questions popping up in the chat box. I want to thank everyone for being with us today for our last Safety Council meeting of 2021. So we will see you again in January. Like I said, our topic will be on active shooting, and that'll be presented by a representative from the Wayne County Sheriff's Department. Registration for that program will be open soon, definitely before the holiday, and that can be found on orrvillesafety.com. So thank you so much for joining us today, and we'll see you soon.